Hi, Dr. Keefe here. I wanted to demonstrate MModal, which is a voice recognition product that you may have heard of. It's a competitor to Dragon, and the benefit of it is that your profile is housed on the cloud, so that it can be used on multiple computers, and the actual product is housed on MMPC server, and then there's a desktop version which you put on any computer that you use, and it keeps track of all the words you've taught it, your own pronunciation issues, etc. I've been using a Philips SpeechMic Pro, which is a very good microphone. It's handheld, so you don't have to wear a headset, and you can have it in your exam rooms if you have a computer there, and it's pretty portable. It connects by a USB. So I'm just going to show you now how it works in a structured note. I have a note set up here on a test patient, and I'm just going to do a little quick dictation. The patient returns for follow-up after a recent hospitalization at Novato Community Hospital, period. He presented with cough and fever and was found to have pneumonia with a left lower lobe infiltrate, period. He was started on antibiotics, and then about 3 days into his hospitalization, he developed atrial fibrillation that was picked up on the monitor, period. He was treated with rate control and anticoagulation, and was started on diltiazem and Coumadin, period. New paragraph. He now follows up 2 weeks after his hospitalization and is off of antibiotics, period. His cough and fever have resolved, period. He no longer feels any sensation of palpitations, period. New paragraph. Reviewing his chart, he had an echocardiogram done while hospitalized, which showed an ejection fraction of 60% and mild aortic stenosis, period. His thyroid levels were normal, and all of his blood testing was unremarkable, period. New paragraph. Previously, he has not had any significant cardiac abnormalities, period. He does have a known left bundle branch block, but previously underwent workup, which was negative, period. He had an echocardiogram 5 years ago when this was initially discovered that showed aortic sclerosis, and he had a nuclear stress test which was normal, period. So now I'll just skip down to the discussion and summary. This is an elderly patient with recent pneumonia who developed atrial fibrillation, period. He is asymptomatic and his rate is well controlled, and he is anticoagulated with Coumadin, period. The likely plan will be a continued program of rate control and anticoagulation, period. Once he starts exercising, if he feels very symptomatic, then we may consider cardioversion and attempts at sinus maintenance, period. New paragraph. With regard to his aortic stenosis, this is quite mild, period. We will repeat an echocardiogram in 2 to 3 years, period. New paragraph. He does have a left bundle branch block, and this will be followed with serial EKGs, period. Alright, so you can see that that's pretty good. I don't know if there was any minor errors in there, but I'm usually looking at it and trying to correct it. And the rest of the note I just do structured. That's incredibly faster than it is with using Dragon. This is also dictated straight into a remote desktop for MMPC, so I can minimize this screen and I can go to another screen in another exam room and pull up the exact same note and continue dictating there using MModal. Dragon really works much better either cutting and pasting it into a note or using a web version of all scripts. So anyway, we're going to be having people out demonstrating this in a month or so, and showing those of us who are going to use it more tips. If you're interested, let Ted or Lynn know. Thanks.